I'm Meghan Barp, President and CEO of United Way of Greenville County. Welcome to Center Stage. I am joined today by Dr. Saria Saccocio of Proactive MD and Pastor Sean Dogan of Long Branch Baptist Church. Welcome, both of you. Good to see you. Sean, we're going to kick it off with you. Tell me a little bit about how you got involved with United Way and why it's important to you.
I've been connected with United Way for many years. It all started after a legislative breakfast hosted by United Way. And during that breakfast, some of our elected officials questioned United Way on how is the faith community involved with conversations, decisions. And it was a person by the name of Loy Rovin who started to organize the Faith-Based Roundtable. And I was asked to be a part. And from there, I have stayed engaged with United Way, mainly because of the United Way's mission, but also the partner agencies. We have some wonderful nonprofits in our community that's doing an outstanding job in the Greenville community.
Excellent. I love that. And the Faith-Based Roundtable continues today, and we're going to come back to that in a moment, because in a lot of ways, it's been the foundation of so much of our work in Vibrant and Equitable Communities. So thank you. Glad that you're here this morning. Saria, how about you? Talk a little bit about your connection to United Way.
So I'm currently the chair of our Community Impact Committee and am honored and thrilled to be able to serve with Pastor Dogan in this role. For one, it's been an incredible opportunity to truly understand the impact we've had in our neighborhoods and the work that United Way does and convening with our community partners to do the same. And I've probably gotten involved with United Way, much like many of us start, in the traditional sense of I've given for many years to United Way through my employer, and it wasn't until a colleague of mine at work, at the time Emma Barksdale, and we know Emma very well. She is a fire starter for United Way and encourages others to step up. And she did the same for me and inspired me to engage with the United Way through the campaign committee. What an incredible opportunity. And I'll say that my heart was in United Way, and giving is something that's been a part of my personal values. But to hear the personal stories of employers across Greenville County and to share, in fact, what some of their employees have and how they've benefited through United Way, just stirred this passion and this fire in the belly for me to understand and seek to learn more about what we do in our communities through United Way and our community partnerships.
Yeah, thank you. And you're touching on some critical aspects of our work as we've spent the last couple of years really digging into what our community members are telling us in our neighborhoods. This is more than just the United Way team talking about this, and even our Community Impact Committee. We've done some pretty rigorous research through our neighborhood change study in partnership with Furman, some community conversations. Why is it so important to engage community members who may be struggling to make ends meet in our work and our decision making at United Way?
So first of all, doing work to people or assuming we're serving them to their best benefit without bringing them to the table and having the conversation is a big misstep. We've learned this over time. Each neighborhood we know is unique, and we all have basic needs that need to be met, but how we go about serving and connecting in ways that our culture and that our communities have developed is paramount. Without really understanding languages, and language is much more than just the English or Spanish or other languages that we speak here. It's about how we connect and understand one another is so very important. And I think about some of the numbers that we've seen in our community. Numbers are numbers oftentimes, but until we bring it home to how this is affecting us as individuals is so important. So knowing that almost 64,000 individuals and families don't have food on their table and have food insecurity, but we don't all secure food in the same way. And that is a conversation that we don't understand until we connect to the neighborhood and learn, where did they get food? Where are the grocery stores? Is it the Dollar General? And without understanding our personal neighbors and our communities and those who can help secure these partnerships, we miss the boat if we don't.
Well said. And Pastor Dogan, you've been so deeply engaged in our community. When I think about the phrase vibrant and equitable communities, I often think about the work that you lead on behalf of Long Branch Baptist Church and so many other hats that you wear in the community. Tell me a little bit more about what that means to you, this phrase of vibrant and equitable communities.
Yeah, Meghan, when we talk about vibrant and equitable communities, we're really talking about the safety of communities. We're talking about how communities thrive, and not just thrive, but also win. Not just the struggle to exist, but actually overcoming barriers and obstacles to allow young people win, and to allow seniors in our communities to be able to rest comfortably with food, and to make sure they have all of the necessities that they need, and not struggle or wonder, how am I going to afford food, medicine, and other essential things. When we look at Long Branch, or even the faith community, it is looking at how do we come to the table also to not only bring the stories or the information, but how do we link resources? And so I think an equitable community is looking at all of us not as different, or looking at individuals as this quantitative data, but looking at it as the qualitative data too. It's the stories, it's the history, it's the culture, it's the respect of all of those things, and appreciating the lived experience, that just because I didn't grow up the same as someone else in our same county doesn't mean that I or they are less valuable to our community. So I believe, when we are talking about a equitable community, it is about respecting the value, the dignity, the safety, and having that camaraderie, and not just with words, but also in deeds and action. And to make sure that the lift is equitable for everyone and not just for a certain group.
Yeah, well said. And you touched on an important piece that Saria also touched on. One of the pieces of research that we commissioned at United Way was a race equity index in partnership with this neighborhood change study through Furman. And what surprised a lot of folks in reading that report was that the zip code that our children are born into can determine their later success in life. And that's a real need as we think about the African American community in particular in Greenville County, whether it's education, financial stability, birth weights, home ownership, all of these different things. A lot of that has inspired our work around the Racial Equity and Economic Mobility Commission. Speak a little bit more about why that's so important in our community.
It's important to start with data, and it's important to start with percentages, but you can't stop there. You have to ask the question, why? Or why is this still existing? And why in the century that we live in now, with all of the reforms, with all of the legislation that is there that supposedly lifts community, why isn't it working? And it has to be reasons why. And when we look at it, we see that there are certain systems in place and certain policies still in place that would not allow this upward mobility to exist. So when we look at commissions like REAM, Race, Equity, and Economic Mobility, we're looking at a group of leaders coming together to really hone in, especially data in the Black community, and why these barriers exist, and how do we either eliminate these barriers or how do we empower people to overcome these barriers. And with REAM, we're looking at this data, especially in education, income and wealth, health and wellness, and we're also looking at criminal justice. With all of that, it comes with education. It comes with a community-wide learning that can only exist if we come together and really look at the data and also hear the information that's even behind the data.
Yeah, well said on that. Saria, when you think about vibrant and equitable communities and the work that we're leading in this space, where do you see the biggest needs? We've touched on some really important issues. From the seat that you're in, what are some of those really big needs?
Well, first, Sean, I agree with you 100% in the work that we need to do. The information and the data is a piece of what we do, but we've got to lean in to those personal and unique stories. In some areas where we can do that is, first of all, empowering our residents and our stakeholders to organize. And we've seen much organization in Greenville, but not enough yet. And by convening these groups, we can help mobilize and leverage our assets. And we have tremendous strength and riches in our communities, but where are the dollars flowing? And are they reaching the individuals so that we create that equitable environment, regardless of your zip code, regardless of your neighborhood? And policy and advocacy has to be a part of the work that we do on a routine basis. Are we lasering in on racial equity policy? Are we advocating for economic mobility in ways that integrates our systems to make that difference? We have so much opportunity, and we've got the right people in Greenville County to be able to do this. So I think that's really important in the work that we do, but we can't do it alone at United Way. It takes our entire community working together. We go so much further when we come to the table and ensure that every voice is heard and every human being is honored.
Yeah, you're touching on something I think that is really, really important, which is we can't program our way out of some of these big issues, right? We have to collaborate in new ways. We absolutely have to have a focus on policy and advocacy in new ways also. But it's also about identifying who are those advocates in the community, who are those smaller organizers that may not be a 501c3, that may not be our traditional nonprofit, who can help us move this work forward. And I think that's an important aspect of the shift that United Way made in a lot of ways of trying to look more broadly at who is doing this work that can help us move the needle on really, really important issues. So that to me is an embodiment of vibrant and equitable communities that both of you are describing. So we know that we are still in the midst of a global pandemic. I know that many of us were hoping that we would be out of it by now and that would be in the past. It seems like it's a mainstay for at least a good amount of time now and into the future. Saria, talk a little bit about healthcare and how this fits into this. And then Sean, I want to hear from you as well because you've done a lot of organizing in this space too. But talk about vibrant and equitable communities as it relates to healthcare and what you're seeing from your perspective.
Well, Meghan, considering the pandemic that we're living through and we're hopeful to put behind us in the past, what I recognize, and I'm sure what many of us are, is that this is a new way of living. What I appreciate about this pandemic is it has truly shined a light on healthcare disparities and how it impacts individuals. Yes, the socioeconomic status is a part of this, but it's also about racial inequities. And what I'm grateful for are the people who've come together because of that. The Robert Wood Johnson Foundation has a website. You can enter your address and it'll tell you how long you're likely to live. And when I put in my neighborhood and my address in Simpsonville, South Carolina, the good news is I have the opportunity to live to be about 83 on average. However, when I type in a zip code across town, in fact, right next to downtown Greenville, that likelihood to live is hovering at about 78. 5 years difference just based on the neighborhood I live in. This comes back to healthcare. Do people have access to medications that they might need? Do they have safe places to walk and move? Do they have healthy food in their neighborhoods to access? So you cannot have economic mobility. You cannot have racial equity in spaces where you don't also provide equitable healthcare. And I'm excited to see the changes that are being made because of this information that has risen to the surface and the work that we have ahead of us. I'm very optimistic about our partnerships together to begin to address this one by one and ensuring that we have safe neighborhoods that are thriving from healthcare and equity in all senses of the word.
So I have found that a lot of people are surprised when they hear that about Greenville, South Carolina, and the upstate. It's very easy to go from point A to point B and see all of the wonderful things that our community has to offer. We're on the top 10 list for nearly everything. It surprises people that we are also on the top 10 list as one of the hardest places to climb out of poverty. So thinking about what you just mentioned, Saria, Sean, talk a little bit about what you're seeing on the ground and the work that you've led in this space to change that.
Yeah. So Meghan, I want to first start off by talking about a trust factor. That when we look at healthcare and we look at other areas of our community, residents in the community will want to access these things based on the trust that they have. Trust that, one, they're going to be treated fairly, trust that the information is going to be correct, and trust that if they do what the person says do, that it's going to affect not only them but their children as well. We have seen during this pandemic that people have made choices. We see people making choices as far as, do they take a vaccine or not? Do they wear a mask or not? Do they go back to work or not? And all of these are based on the trust of the information. I truly believe, especially in the faith-based community, and I'm getting to organizing, that there's power in the pulpit. There's power in the pulpit not just to lead spiritually, but there's also power in the pulpit as far as the trust level. And when leaders say things to their constituents or to their congregations or to their communities, those leaders are trusted. And so utilizing that influence to help better a community is something that I believe is very important. So when you ask me about organizing and kind of being boots on the ground, we have found it necessary to utilize the pulpit to talk about trusting the information that's coming from the health field in the healthcare community. I tell people this: if you're going to trust your doctor to help you with hypertension or diabetes, you have to trust them to help you through even this pandemic. That the trust doesn't change just because political persuasions may shout this or shout that. That you have to still listen to those who are called, who are gifted to do the things that need to be done and to give that information. So Lone Branch and other faith communities have worked with other nonprofits to organize seminars and webinars about COVID-19 and the vaccine. We've utilized the faith community to help get information out about resources in our communities, such as utility assistance and also rent assistance. We've utilized our spaces to give way to other nonprofits or even other organizing groups to utilize our space in order that they can have meetings or that they can safely distance in order to get the work done. So I think it's all of us coming together and doing the things that we can do in order to help our community.
Yeah, thank you. And I know that one of the things that we share, both of you serve on the board of United Way of Greenville County as well. And I know one of the things that we share in common is that we collectively believe that if any community can tackle some of these pressing issues, it's Greenville County and the upstate of South Carolina. So what does success look like in this? Thinking about the investments that we're making, not just financially, but with the time and the talent of so many leaders, what does success look like for us as a community? And Sean, I'll start with you.
Yeah, success to me looks like my daughter being able to succeed in any field that she decides to go into, that the community's resources will be there to aid her, that she will be able to have access to health care, that she will be able to achieve the educational levels that she wants to achieve, but not just for my daughter, but for every family and for every young person that is coming up through our school system at this time. It is when seniors don't have to worry about will their Social Security checks really last the entire month. It is when nonprofits are able to give services to our community and meet the needs of our community and ultimately work themselves out of being needed. That's when we have reached success. We've reached success when we can come together and, despite our differences, still respect each other and still want the best for our community. Those are kind of the aspirational things. Success also means that our poverty rate decreases, our graduation rate increases, that the number of people who need can receive adequate health care, and that more than 4% of those who are born in the lower quintile can make it to the upper quintile. That's success.
Saria, how about for you? What does success look like?
Well, first of all, Sean, I love the picture that you paint, and that truly is the success for Greenville County and recognizing true equity. And we've talked about healthcare and how important that is, having the access to and not having to decide, particularly for our elder residents, between food on the table or medications in their body. It's important that our children are at the appropriate reading level, that they have access to books, that they have the support and the resources to meet them where they are and raise each other up so that we have equitable opportunities. I think about college and technical school. For those who choose technical school or college, to have that dream available to them, regardless of what high school they go to, and that they indeed walk across that graduation line to accept that diploma and know that they deserved it, that they had the opportunity that any child had in that instance. And then what I'd like to see, Meghan, is that when we put in our zip codes across Greenville County into the Robert Wood Johnson Foundation site, everyone has 83 years. And forget about 78 or 77. In fact, let's increase that number above 83. Why not 85? Why not higher? And to enjoy those years that we live. And then I think it's also important that every person in Greenville County recognize their gifts that they have to help their community. Sean, you talk about trust, and it comes back to that cornerstone of trust. When we trust one another and recognize that we all have treasures, that we all have helping hands to give and make a difference in our neighborhoods and our neighboring neighborhoods, that is true success of Greenville County and the United Way.
Thank you, Saria, and thank you, Sean, as well. You know, one of the questions we get on that note is, gosh, I want to do something. What can I do to contribute to my community so that I can help that vision come into fruition? So, Sean, for folks who want to get involved, what would you offer up to them?
You know, there's an old slogan by Nike, and that is just do it. Like, pick up the phone, call United Way, and find out how you can get plugged in. United Way also has a list of what I call vetted agencies that are partner agencies. Those agencies and our partner agencies, they need capacity building as well. And when you hear of needs in our community, especially needs as far as resources, United Way's website is great with not only giving us that information or telling us what that need is, but also giving towards those great campaigns that are out there to give a lift to our community.
Yeah, thank you so much for that. And that is true. One of the things that we discovered during COVID in particular is that, gosh, we have so many nonprofits, but the cracks are starting to show on that infrastructure because they're under-resourced often. So United Way is a great place to start to help fill in some of those gaps that we're seeing. So thank you. Saria, how about for you? What advice would you have for people who want to get involved in some way in the community?
First, it's important that we all do our part. And our part looks different to every individual. And I think it's important to give of our treasures, whether it's the $5 Starbucks, and I love coffee myself, but $5 can make a difference in a meal for one individual. $5 puts food in our bellies. I also think that giving with your hands is so important. Our United Way website offers tremendous opportunities, hands-on Greenville, numerous ways, based on your talents and what interests you. And I think it is important to look at all of those partners that we have in our community and find your passion, what matters most, but just do it. Let's work together. We do it best that way. Roll up our sleeves and find the way that gives where you feel it has the greatest impact on the community. There's something for everyone out there. I even have my children participate when we have our food drives. They collect the food in the grocery store. They drop it through the drive-through line. And as we look at starting up for school again, packing those backpacks, every little bit makes a difference. And I find oftentimes, Meghan, that people don't give because they feel that it's not enough. Well, what can my $5 do? What can my $100 do? It does a lot when we all do it.
Yeah, thank you for that. And I hear that all the time also of, gosh, will this really make a difference? And yes, it makes a huge difference, whether it's that $5 for the meal. Sometimes it's $40 to pay an electric bill, and that's just the help that somebody needs to, get through a tough time. So, all right, I'm an optimist, as you both know, so I want to end on a high note. What is giving you hope? Pastor Dogan, I'll start with you.
I think what gives me hope is seeing community come together and seeing the empathy and compassion that Greenville actually has. Anytime there's a crisis, we come to the forefront and we make it happen. I don't want it to have to be a crisis. I want us just to be who we are. And that's what gives me hope. Everyone being who they are, the great people of Greenville County.
Saria, what gives you hope?
What gives me hope, Meghan, is participating and volunteering for our community organizations and really understanding the impact they're having. Our On Track Greenville program through United Way, the schools that are being raised up, and it's not just the students, but the teachers who now feel supported, the principals who have a direction and resources available. It's those individual programs through AmeriCorps, Ivitas, and the money that's coming back to Greenville because we're empowering individuals to file tax returns, the money that is due to them, and then helping advise them to wise ways to support and shelter their own families and feed their families and put that food on the table. It happens every day. And Sean, as you said, no matter how limited the resources, we all come together in Greenville County. And we see it time and time again. The pandemic has shined a light on the partnerships that have developed. The creativity that exists in this part of South Carolina is like none other that I've experienced. And it makes me hopeful for what we have in the future. And those partnerships that continue to strengthen will lead us out and into the light.
Well said. Well said. Pastor Dogan, Dr. Saccocio, thank you both for being such incredible leaders, and it's just an honor to walk alongside of both of you in this work at United Way. Thank you both for your time.
Thank you.
Thank you.